My name is Nick Mancuso. I'm here in Toronto, Canada, in front of the Metro Toronto Convention Centre, where the CHFA, the Canadian Health Food Association, is having its annual meeting. Today we spoke to several manufacturers and suppliers about the impact Health Canada is having upon the health food industries of Canada. I'm here with Rheece Hartte of Preferred Nutrition, and I believe also you have another company, don't
Transforming
you?
Health.
Transforming Health.
Mm-hmm.
And you're involved in the whole natural food industry and the nature of healing and supplements and vitamins.
Absolutely.
How long have you been doing this?
Just over 20 years.
So you know a fair amount about how to maintain health.
A little bit.
And you think it's very important that people take supplements and vitamins for their health?
It's really important. It's part of a holistic lifestyle, really. They should be exercising, eating properly, and taking supplements.
Well, you certainly are an example of that.
Well, thank you.
You look like you're very healthy and very strong. What products do you sell? What products do you advertise here?
Well, we have a number of different lines at Preferred Nutrition. We have a women's line of products. We have the Brad King line of products, and we also have a Immunicare and a Preferred Nutrition brand of products as well.
And you're based up here in Canada, is that correct?
Yeah, from Kelowna.
Where are you from? Kelowna?
Kelowna, British Columbia. Yeah.
How did you get into this particular field?
Well, I started off when I was a kid, actually going to vitamin stores when I was very, very young, in my early teens. And I used to go in and just read vitamin bottles and find out what was in them. And then I'd go home and I'd go read a book and find out what they were about and how they worked. And then I got into the health club industry and started helping people there. And I would talk to people all the time about supplementation and taking care of their health. A friend said to me one day, he said, well, why don't you go into the business of doing that and really helping people? So there was a vitamin company that hired me at that time, and I just carried on from there.
So you're really almost born into it and really know something about it from experience,
Exactly,
right?
yeah.
Not from, sort of theory.
We see positive results every day.
Right. And so it's very, very important. What do you think of this recent situation up here in Canada about some of the legislation that is being pushed through that is going to stop people from having access to vitamins and herbs?
Well, it's disturbing, Nick. I mean, people should have a choice of what they put in their body. It's kind of ironic that we can have convenience stores that have, mega sugar. They can have alcohol in the store. They can have cigarettes in the store. And right next door, we're being legislated to not have healthy supplements. So killing people over here, or the opportunity to kill people, and not wanting the government not wanting healthy supplements over on the other side. It's kind of odd.
It's pretty outrageous if you really think about it, particularly since it seems to contravene every right of a citizen in a free society.
Absolutely.
And particularly since health is really the issue here.
Well, and health is a big cost to the country as well. Whether it's the provinces, the federal government, whatever. And as an aging population grows and grows older, it just becomes more of an issue. And so they tend to move over to pharmaceutical drugs, and that comes with its own bag of tricks as well.
Well, isn't Health Canada really shooting itself in the foot by doing this? It's supposed to be protecting the health of Canadians. Mm-hmm. How does this protect the health of Canadians in your mind?
I have no idea. I mean, it doesn't. We have safe products right now. Nobody's died from a natural health product. Always people are dying from drugs. Drugs are, one of the biggest killers on the planet. Alcohol kills, cigarettes kill. And, I'm not saying don't drink or don't have a smoke. It's just they kill people. So you should have a choice if you want to take it or not. And you should have a choice on the other side whether you want to take supplements or not.
Right. You should have a choice to choose how to heal.
Exactly.
Right. I totally agree. Well, I think it's a wonderful thing you're doing. Continue with the good work.
Thanks.
And we're going to try to get the message out there to Canadians and also really around the world, because this is something that is happening everywhere.
It is.
And something needs to be done.
Yeah.
Is there anything you could advise the audience about how to protect their health?
To protect their health?
Yes.
Well, everybody should eat well. They should exercise and then take some sort of supplementation. At the minimal, they should take a good, complete multivitamin. For men, they should take care of their prostate after the age of 35. And everybody should be taking something to reduce estrogen dominance, men and women, to get rid of those cancer-causing estrogens in their life.
So stress is the number one killer.
Stress is the number one killer, absolutely. You know, people are, but they're constantly under stress, and sometimes they just don't recognize it. You know, one of the ways to recognize stress is, you know, something may happen and you jump like a cat, right? You might find that somebody cuts you off in traffic. It's really about overreacting. So when you find that you're overreacting to things, your stress, your adrenals are compromised.
And these vitamins and supplements can help with this sort of thing.
Yeah, we have a great product. You know, there's a lot of good ones out there. We have a product called Ultimate Anti-Stress that really nourishes those adrenal glands and brings them back to good health so that you can manage stress better. We're not going to eliminate stress. We're just going to be able to manage it better.
Well, thank you very much, Rheece.
You're welcome.
You've been a wonderful guest.
Thanks, Nick.